I'm talking to you today about the plans that we have in place to manage the coronavirus. Clearly, this is a rapidly changing and evolving situation, and it's important that our plans would also be able to change to meet those requirements. We're working very closely with our colleagues in the community and in public health to make sure that the plans that we have in place in the hospital are meeting the needs of the population that we're serving. Right now, the important areas that we're focusing on is making sure that there's a clear pathway of care coming into the hospital for patients that are either suspected of having coronavirus or confirmed cases. We're also trying to make sure that there is capacity within each of our hospitals in order to be able to respond to this changing needs. And that means freeing up beds. So some of the measures that we've taken to achieve that is that we have cancelled or deferred electives on all sites to try and make some capacity. In addition, there's been very significant numbers of patients discharged from our hospitals over the last number of days, and particularly towards the end of last week. This has helped to create some capacity that we hope will be available to us and will be able to help us to manage patient throughput when the need arises. We've also been looking very closely at our capacity in our intensive care and critical care services. We've done a full assessment of what is there currently, both in terms of equipment, beds and staffing. And we've also looked at other areas where we can develop additional beds and additional ventilated beds if and when they're required. It's important that this planning is put in place now so that when the need really arises, that we're ready to go. We're working very closely with our colleagues, as I said, in public health and in the community, because we know that this has to be a joint effort. If we're to manage or slow down the development of the coronavirus within this community and across the whole population that we're serving, it takes that joint effort. So I'm asking all staff that are working currently in the Saolta Hospital Group to contribute where you can, both in terms of patient care in your department and on your ward, in your own homes, and in terms of the actions that you can take yourself with your families to try and ensure that the spread of the coronavirus is slowed down to the greatest possible extent.